in today's video, I'm going to test you on 20 questions that a patient may ask you in your OET speaking test or actually in real life. Remember, in the OET speaking, you'll be given two role plays that you have to go through with an interlocutor who will play the part of the patient or the carer, perhaps. During this time, you'll be assessed on a various set of criteria. We've gone through a lot of this already in my previous videos, but this time I want to focus on relationship building, which in particular looks at you being able to initiate the interaction appropriately, demonstrate an attentive and respectful attitude, adopt a non-judgmental approach, and show empathy for feelings, predicament, or emotional state. And this is what I really want you to think about during your answers to these patient questions. How can you be attentive and respectful? How can you be non-judgmental in your response? And how can you show empathy genuinely without just saying, "Oh, I'm so sorry," which doesn't always sound very sorry or very genuine. How can you show empathy for their feelings or their predicament or their state emotionally? What can you do? So here are 20 questions, as I said. They're not in any particular order. They don't all come from the same role play. I've just given you a really nice mixture so you can just think about building those skills that you need before your OET exam. My name's Sona, I'm your online OET tutor with Bose Learning, and I'm a premium preparation provider of the OET. Okie dokie, so what's going to happen in this video is I'm going to give you 30 seconds to read the question the patient asks you. In those 30 seconds, I also want you to formulate your answer, bearing in mind the criteria we've just looked at, and then I want to go through a sample reply with you. Obviously, there's many different ways to reply. It often depends on the scenario, and this time I've not given you the scenario. I just want you to kind of think of a response that you might use if you like, and I'll go through an example with you at the end of the 30 seconds. Okay, so if you are ready, let's begin and invest that time in building your skills for your OET. Here we go. Okay, so rather than just a generic, "Oh, I'm so sorry," try and name the emotion or the condition or the predicament that the patient is in. An eczema flare, we all know, is uncomfortable. So you could start by saying, "Oh, that must be uncomfortable." And then rather than just a blanket yes or no for the antibiotics, try and explain when you prescribe antibiotics usually, and also find out, why does the patient want them? Don't just dismiss their idea completely, be respectful. So we only usually prescribe antibiotics if there's an infection. Do you suspect one? Is that why they want antibiotics? Or do they just think antibiotics are a magic pill that they can take? So find out more, don't assume. Okay, here's the next one. Okay, so again, a very common question. Um, be honest, be realistic. You might feel a quick, sharp scratch when the needle goes in, but it only lasts a few seconds. Again, if the patient is a bit anxious, I'll make sure you're as comfortable as possible. Comfort's very important again because they're feeling stressed, so you want to make them feel comfortable. And if you feel worried, let me know and we can take it slowly. Okay, next. So again, there could be many different reasons for this, and in the actual OET, the role play card will give you more advice and more of an indication about what's going on. They'll always tell you what's wrong with the patient. But, as a kind of standard answer, again, acknowledging what's happening, that sounds unpleasant. Dizziness when standing can sometimes happen if your blood pressure drops quickly or if you're a bit dehydrated. So explain. Remember to pause in between your explanation. Explain what you're going to do. I'll check your blood pressure in a minute. In the OET, you never have to do an examination, but that might come later in the after the OET role play, for example. So you can refer to that. That's fine. But can I ask you some questions to find out what might be causing it? And this is probably going to be directed to you in the role play as well in your task card. So that's one way you could answer this. Okay, here comes number 4. Okay, so, again, find out why they're so keen to go on the gym. You can make a guess. I guess you must be a gym fan. But I'd strongly recommend resting until you've fully recovered. So, any advice I'd strongly recommend if it's something you firmly believe in. If it's stronger, you must rest. Um, so, depending on how strict you need to be with this particular condition. Explain why exercising while you have a chest infection could make your symptoms worse and delay your recovery. And again, if they're a fan of the gym, if they love going to the gym, then, once you're better, you can gradually return to the gym, and I'm sure you'll be back to normal soon. So, a good question here. I'm sure you've had to answer this many times. You could say something like this. That's a really good question because there is one. It makes sense. Why do I need to continue taking medicine if I'm okay? Well, even if you feel better, some of the germs may still be in your system. If you stop early, the infection could come back or become harder to treat. Finishing the course, make sure the infection is fully cleared. So some people may feel a bit nauseous with these tablets, but not everyone gets that side effect. If you do feel unwell, reassure them, let me know, and we can look at ways to reduce it or consider an alternative if necessary. So, again, be genuine, be honest with them, try and reassure them, and then, provide an alternative if it's necessary. And this is the million-dollar question, isn't it? How long will it take until I start feeling better? Well, again, it depends on the situation and the patient you've got in front of you, and your role play card will direct you to more information about that. But one way you could say is, recovery times can vary from person to person, but most people begin to notice improvement within a few days. I'll give you advice on what to do to help your recovery and let you know what signs to look out for. So, again, being honest, answering their question, and then signposting the next stage of the consultation that you're going to give them advice, and then also, danger signs or red flags, that kind of thing. And one of those heart-stopping moments, I'm sure none of you get used to, giving bad news. But, if it isn't bad news, you could say something like this. Again, understand that the patient is worried. So I understand this must be worrying for you, but from what I can see right now, there's no sign that this is cancer. However, to be absolutely sure, I'll arrange some tests and I'll explain each step so you know exactly what's happening. So think about what the patient wants. The patient wants to know, to be reassured. Um, Maybe if you do suspect something, you can say, well, I can't be sure. That's why I can't say either way for the moment, but I want to arrange some tests for you. And then again, it's that reassurance that you'll be there to explain the steps so that they're not left in the dark. They want to know what's happening. That's the main thing, isn't it? Okay. So again, it depends on the patient, the situation, the actual antihistamines that you've prescribed. But you could, say something like this. Well, some antihistamines can cause drowsiness, which could make driving unsafe. I'd recommend avoiding driving until you know how your body reacts. If you feel sleepy at all, don't drive. Again, this often depends on the situation. Acknowledge their concern. I can understand why you're worried about that. At this stage, surgery isn't necessary. We'll start with simpler treatments first and would only consider an operation if those don't work. So, again, be honest with the patient and reassure them. Okay, we're halfway through. Well done for keeping going. Let's do another 10 and we'll see how those go. I'm so sorry to hear you're struggling, or I'm sorry to hear you're struggling with the pain at night. Have you tried any over the counter medicines? So, again, find out from the patient what they've already tried or other remedies at all. Perhaps they've tried herbal teas or yoga. So, don't just lecture them, find out what they've already tried first. So again, it depends on the situation, but if the answer is a yes, then yes, that should be fine. Your condition is improving well, and as long as you continue with the treatment and look after yourself, you'll be safe to travel. I'll also give you some advice on managing your symptoms while you're away. So you've probably heard this many times, either for themselves or their young child, maybe. And yes, I would strongly recommend it. This vaccine helps protect you against serious illness and it also reduces the risk of passing the infection on to others. Again, find out why they're worried and, offer that reassurance. I can explain how it works and what to expect afterwards if that would help you feel more comfortable. You could start that by saying, can I ask why you are hesitant? Find out first and then carry on with your explanation. That's a very good question. So, again, this can even buy you a bit of time to think about your answer. But again, this is something you should have planned and plotted out in your preparation time. Um, there can be a hereditary link, but lifestyle and environmental factors also play a big role. Again, it's signposting. I can explain what you can do to reduce your risk of flare ups and keep the condition under control if the patient wants you to. So you're asking permission as well. So with this one, you could say something like, some people do notice changes in weight with this medicine, but not everyone. I'll give you advice on maintaining a healthy diet and regular activity, which can help minimize any effects. And if you have any concerns while taking it or while I'm explaining, maybe let me know and we can review it together. And you can say that if if you've got any questions, just interrupt me, ask me, let me know. So it kind of depends what it is, but if your symptoms get worse, please contact me straight away. Or if it becomes severe, go to the emergency department. So give your explanation and then signposting. I'll also explain the warning signs you should watch out for so you know when to seek help. So, this one, that's something we can certainly discuss, but just so that I understand, why do you want to stop the current treatment plan? So, again, explore their concerns. You're taking on board what they're saying, and that's great for relationship building because the patient knows you're listening. So, this is a predicament I'm sure lots of patients find themselves in. Understand that predicament. I understand that resting may be difficult with your work commitments, but even if you can't take time off, I'd suggest adjusting your workload and taking short breaks when possible. That way, you can recover without putting too much strain on yourself. I'd be happy to write to your line manager about that. So, you're in it together, you're there to help your patient. Flying with an ear infection can be quite uncomfortable and some cases unsafe. The changes in pressure, so you're giving your explanation now, during takeoff and landing can cause severe pain or even damage the eardrum. Pause a little bit there. I'd recommend postponing your flight until the infection has cleared. But if travel is unavoidable, I can suggest ways to reduce the discomfort, such as a nasal spray and chewing during the flight. And we're at the last question now. At this stage, your condition can most likely be managed here, So a specialist referral isn't necessary right now. So you're not dismissing their concerns completely, but you're explaining why you don't think it's necessary now. If things don't improve as expected, I'll arrange for you to see a specialist for further assessment. Okay, well done. That's your 20 questions done. You've done great to spend this time today to build your skills, invest that time in improving your knowledge and getting ready for your exam. If you want more practice, then why not take a look at my on-demand pre-recorded courses, which you can find on Udemy, and I'll pop a link into that below. And I'd be so happy if you could help me grow this channel by sharing it, liking it, comment. If you want more of these 20 question styles, then let me know. Or if you want fewer, you just want 10 because you don't have time to sit through 20, then let me know about that as well. And why not join me for a daily dose or a regular dose of all things OET on my Instagram and emailing list. And why not join me for a regular dose of all things OET on Telegram or email? Till next time, take care. Thanks a lot. Bye.